The state investigated more child fatalities in Duval County last year than in the 8 nearest counties combined. Here to discuss what is and is not working when it comes to child abuse is Stephanie Metzger, Director of Prevention Services at the LJD Jewish Family and Community Services. Good morning, Stephanie.
Good morning. Thank you for having me.
Thank you for being here. We're also joined by Lynn Salvatore, practicing family law attorney and former DCF attorney and guardian ad litem attorney. Good morning, Lynn.
Good morning. Thank you for having me.
Thank you for being here. And welcoming back Nicole Davidson Harshaw, a licensed mental health therapist who works with kids in crisis. Good morning.
Good morning, Ann. Always a pleasure.
So, the current state of child abuse in Duval County, we know that some recent DCF data show that there is a decline in child abuse rates among children who are 5 to 11 years old. That's good news.
Mhm.
But Duval County's rate remains higher than the state average. Nicole, you work with kids on a daily basis.
Mhm.
What is it that you think you can attribute that disparity to here in Duval and in Jacksonville?
Yeah, the parental mental health issues have been prevailing for some time. And when that's a perpetual problem, a parent does not have the ability to emotionally regulate if they have their own unresolved trauma. And so we could easily see either undiagnosed or unmanaged depression, anxiety, if there's that level of not being able to provide the financial security, the basic needs of life, to be able to provide them with food and stable shelter. And so if a person cannot get up out of bed and take care of themselves, if they don't know how to manage their own well-being, how do they know how to manage the well-being of a child? And so in those instances, we can see the prevailing issues become very crisis managed, unmanaged.
And what do we see? Is there something unique about this region or this place that Duval has been, has not seen that decline that some other places have seen?
Mhm. I think what we can say is that maybe the resources in the community are not as accessible, and I'm sure we'll touch on that a little bit today. But we do want to make sure that we're mindful that we want to make those mental health resources more accessible, more affordable, and more within arm's reach for our parents and for our family systems.
I want to just show for the folks that are watching on our live stream, we have what's a heat map that was created by the Department of Children and Families that sort of shows the circumstance when it comes to child abuse in the region and in the state. And you can see that Duval County really is alone in North Florida, Northeast Florida, and all of the North Florida region, basically north of Orlando, in terms of having a higher rate of child deaths in particular. This is National Child Abuse Prevention Month. Stephanie, with the Jewish Family and Community Services, this is you're an agent that works with DCF. How do you characterize the problem? When you look at a map like that, how do you explain why Jacksonville and Duval County is so different?
I would link it to resource availability. A lot of people don't know what resources are available to them. And so I think that's really a big part of communities stepping up and reaching out to people to let them know what they can get um, for their families, for themselves, for their children, the different resources that are available. Because I think a lot of people just isolate themselves and don't ask for help. And so that's a big part of the community stepping up and really showing we're here for
Mhm.
you, we're here for your family, and we really want to help be your support network.
Mhm.
How do most of the cases that you see come to you?
So the cases that we get in my programs with JFCS are through DCF, so the abuse hotline. They go out and they investigate abuse or neglect, and then they come over to our programs through that way. But we also have community resources where you don't have to be involved with the child welfare system to get access to those services. So on our website, jfcsjax.org, there's a number of resources that are available to people who are just regular community members, not necessarily involved with DCF.
Yeah. And Lynn, we know that you worked with child safety, child abuse cases for a long time. You're now, practicing family law, and I'm guessing still see cases somewhat in that capacity. Um, what what is it that you have seen over the years in terms of trends? We know that the pendulum tends to swing back and forth in terms of an emphasis on family reunification or on child separation in terms of trying to ensure child safety. Do you see kind of where it's at right now, and how have you seen that change over time?
Um, well, you're going to hear a lot of the same things that your other expert guests have said. Uh, Despite the changes that we have made in the middle 90s, we're still seeing the trend of lack of resources, lack of stability, and a lack of a caring community. Because Jacksonville is a geographic area that is so huge.
Mhm.
It is the largest, I believe, in the state. I think it's really difficult for people to find the resources to be stable. And we have a very caring community, but I don't think the folks know that. And so I think we have a lot more work to do. I haven't seen a decrease in the number of children coming into care. Um, and that's very concerning. But what do we do about it? And that's going to be critical. I still see, and I get cases from Texas
Mm.
that involve families here in Florida. And these folks are very lucky because they can't afford to hire a private attorney. And when the abuse call comes in and I am contacted to help these families, in the cases that I've done, none of the children have had to be removed because these folks have been they've been given the resources, including an attorney who knows the ropes, if you will.
Mhm.
And I am a team player, but these things are very, very critical. And I think Duval County has been lacking in this since I've started to practice in this area in the 90s.
What when you talk about changes in the '90s, what are you referencing there?
Well, I started at DCF in 1995. The environment at DCF was very different. Um, we were not privatized at all. And I'm not making any judgments with respect to whether or not privatization was the way to go or not. But just from the child legal welfare department, when we were all one agency, the attorneys were able to work much closer with all the caseworkers. We developed relationships. We didn't
Mhm.
have the same amount of turnover with caseworkers. It's a very hard job.
Yeah.
We had different resources back then as well, some that we no longer have. Throwing money at it is not going to be the only solution.
Mhm.
And I think what we need is we probably need some type of comprehensive study to show why Duval County is having all of these issues. And we're the worst in the state.
If you're just joining us, we're talking about what needs to happen to move the needle on child abuse cases in Duval County. If you'd like to join the conversation, you can give us a call at 904-549-2937, or you can email us at firstcoastconnect@wjct.org. We have a call from Stephanie in Mandarin. Good morning, Stephanie. Go ahead.
Good morning. So I fully agree there needs to be some comprehensive research done or within the community to see how it's going statistically. But when doing that research, are you worried about underreporting, especially with students getting moved out of public school and perhaps going to homeschooling? I know we saw that during COVID, there was an underreporting of child uh, neglect.
Hmm. That's an interesting question. I mean, has the change in the school model, the public school model in Florida, impacted reporting as far as you know or can tell?
I think when it comes to Stephanie, thank you for asking that question. I think when it comes to the underreporting, and I think there's an issue with when child abuse occurs, a child may not go to school. We may see, start to see the issues with going to school and attending, classes regularly. I'm a therapist now at the LJDJFCS and working with other counselors at DuPont Counseling. I come into contact with those age brackets. However, I want to take just a gentle aside to say that I was also an educator for 13 years. So I've been in the classroom. I've been a Duval County public school teacher, and I'm not going to say anything negative about that role. That was a very rewarding, journey that I took. The reality is, if a child is not going to class, and we don't see the abuse, when they do come to class, the abuse is silent. the warning signs might be there, but we don't see them, like a child that's being abused and distinctively going through neglect will start doing behaviors that are regressive and not congruent with their age bracket, like thumb sucking, bedwetting. They might be fearful of, behaviors of which they were no longer for a long period of time. So there's that regression, but they're not able to focus or concentrate in class. They might be frequently tardy. They could be absent. But to stick with the question, if that's going on, but it does not lean into truancy, I remember even as an educator, those signs would be very invisible. So the underreporting is there. And to your earlier question, when a parent is struggling with their own mental health, there is that part of the abuse, the caveat that's very real. Don't tell, don't share. And so if a child is going through abusive issues, they also don't make the connections with caregivers in the same way. They're not bonding with their teachers in the same way, or even peers their own age. So kids learn very much as a part of that cycle of abuse to be silent. And it's the silence that becomes part of their symptomatology as well.
Stephanie, we were talking before the segment. You have children. We all, have children.
Mhm.
And, parenting is a difficult thing, even in the best circumstances. What are some of the stressors that tend to contribute to an abusive environment as opposed to one that just might be, um, you know, a difficult parenting environment, but one that doesn't lean into a problematic parenting style?
Yeah, I would agree. Parenting is hard, right? Even on
Mhm.
the best day, even in the best circumstances,
Mhm.
parenting is hard. A lot of the things that we see that contribute to stressful environments currently is the housing crisis that people are going through, not knowing if you're going to be evicted or be able to maintain your home. And food insecurity is a big issue. So, not knowing if you're going to be able to provide food for your family.
Mhm.
And those financial stressors just increase the chaos in the household and make the littlest problem seem even that more large because of the stress that you're running into. So I definitely think financial resources are going to be a big help in the community, especially at JFCS. We have the eviction diversion program that's available. And if you can meet your basic needs, then you're better prepared to be the better parent and handle, your child's tantrum better because you're
Mhm.
not stressed out about where you're going to be living.
Did
And
we
where the next
learn
meal's coming from.
Oh, yeah.
Yeah.
I
Mhm.
was just curious, did we learn anything during COVID? I mean, was there anything about the patterns that we had to live under during the pandemic that either, influenced the kind of reporting that we were seeing when it came to child abuse or the kinds of cases that we were seeing? Um,
Well, there was a lot of isolation during COVID. I mean, that we all know just sitting here at this table. And I believe that the mindset of being impoverished and being alone and not having those resources available was exponentially, promoted. And so even to what Stephanie just said, there's the issue with food insecurity, with housing instability, and if you don't know where your next meal is coming from, you're not sure what your next step could be.
And I
Lynn, oh, go ahead.
I was going to say, I think a lot of parents lost their jobs during COVID. So that created the financial stressors, and they didn't have their kids going to school. So,
Mhm.
on top of trying to find employment, they had to also worry about care for their child. And then you didn't get to see your supports. You didn't get to see your friends, your
Mhm.
family, your neighbor, those supports that just kind of help relieve stress when just talking to them. So,
Mhm.
I do think COVID had an impact on isolation in the community for sure.
Yeah.
Yeah. Lynn, there's nothing I think more heartrending and sort of discouraging than when you see a child who's been put into uh, the DCF world, communicated that there has been a concern or that family has been contacted by DCF because of abuse concerns, and then seeing that child later suffering or perhaps being involved in a child fatality because not enough was done. And I kind of am going to return to that question of the pendulum because, there is always this shifting idea about what is the best way to take care of a kid in an abusive household. Help the household, remove the child. Um, is there anything that you learned in your time working in the system and then out of the system about what is most effective and what is happening in those cases where kids are not helped in time?
Well, I think that what is most effective is to link the families up before the abuse occurs to the resources, making sure that they are stable. These are huge stressors, and just our geographic location makes it so difficult to even get to these resources, to learn about them. Mental health is huge, not just for the parents, but for
Mhm.
the children. When the children come into care, finding the mental health treatment that they need is
Mhm.
incredibly difficult. And statistically, children are abused or neglected in foster homes as well. Ideally, we need to try to resolve as much as possible the abuse, the neglect, so that it doesn't happen in the first place. We're all human. We're never going to be able to get to zero.
Right.
That's just not going to happen. But that doesn't mean that we shouldn't attempt to do that. The foster care system, the DCF system, it's the last place you want to be. Sometimes, however, that's the safest place for children. But why? Why is that? And I think we need to work together as a community to resolve that problem. And it's going to take a lot of effort. This People have done studies before. There have been lawsuits in the past, and there have been plans approved by the courts to improve DCF and their processes. But we continue to see the same pattern, and it is that pendulum. We'll go years where we will have lowered the number of deaths of children in Florida, and then it swings back. And why is that?
Well, I'm curious in the cases, I mean, we know that in this area, about a quarter of the cases where there's a child death, DCF has been involved previously with the family, maybe with that child specifically, or perhaps just with the family in the previous couple of years. What is not happening when that occurs?
Well, and I can't remember ever having anyone tell me that we've had enough foster homes in
Mhm.
Florida. And so you do get those pendulums where uh, the agencies are working very hard to try to keep the children in the homes. And I think when we have limited resources for the parents and for the children, that we're going to see more child deaths. And these
Because kids are remaining in the home because there's really nowhere else to place them, you mean?
That happens frequently, and you'll see that with children who are older.
Mhm.
It's harder to find foster homes or relative caregiver homes
Mhm.
for older children. And the older children tend to have a lot more behavioral or mental health issues than an infant would. And again, that just compounds the problem. And those children are at great risk of abuse in their own home or abuse in a foster home. And I don't know the solution, but hopefully as a community we can come together and work towards one.
Stephanie, you work, helping kids with placements in foster homes. Um, we do often hear about kids who are in the foster system who are, re-victimized, who are not safe in their placement. What is it that needs to happen to make foster homes a better place for kids to end up? What would help get more people involved in foster care? Is more vetting needed?
So I think they are increasing the training that they're providing to foster parents through Family Support Services, the licensing agency for foster homes. But likewise, I think that DCF and the CMOs in the area got together into
CMOs being
community based agencies. So in 2008, they did foster care redesign, and that's when a lot of the prevention programs were implemented. I was actually the first worker to pilot a prevention program here in Duval County called the FAST program.
Mhm.
And it's designed to keep kids in the home with their parents safely while providing those services and education, because they did find that putting children in foster care has its own set of traumas that go with it.
Mhm.
Mhm.
It has higher dropout rates, higher teen pregnancies, higher criminal records,
Mhm.
versus if we were able to strengthen that family unit as a whole and keep that family together. And so that's what the FAST program with JFCS
Mhm.
does, is work with those families to provide the education, the services, and the resources to keep them together and build a stronger family unit. And I think ultimately that's the best outcome for kids, is if we can do that safely, and hopefully with the services and resources they receive, they won't have to have DCF involvement again, and that child cannot have that trauma of being removed.
Nicole, in your experience, in terms of children who remain in a home that
Mhm.
has challenges but are able to get some help for that family
Mhm.
versus kids who are removed, I mean, first of all, what has your experience shown, and what has the research shown in terms of outcomes for those kids?
Research has shown, and I don't have the numbers with me today, but it's an ideal way of us approaching the fact that there is something to be said for keeping the unit together. As a family and marriage therapist, when you start getting the communication going, allow that access to workshops, to mentorship programs. It doesn't have to all come from every member of that family unit. This is where we start putting in those resources into the home so that there becomes a daily conversation and they're working within those community resources. I know it sounds odd to say, but as a mental health counselor, we see that kids, even though in circumstances of their parents being abusive, they don't want the abuse to continue, obviously, because they don't want to be mistreated, but they also don't want to leave their caregivers. They love their parents despite the abuse, despite the neglect. They just want their parent to be a good parent. And so, to what we're talking about, keeping that unit together, teaching them how to be more cohesive, teaching them what healthy actually looks like, teaching the parent how to, be employable, manage the day-to-day care, manage hygiene. Something as simple as going to a dentist, going to a specialist or primary care physician, taking their child to a pediatrician for those appointments that are so necessary. Believe it or not, and I don't want to leave this on the table today, but there's something to be said for addressing the poverty that's going on in Duval County. And I feel like that goes back to something, Lynn, that I heard you, explain earlier, food insecurity, housing instability that Stephanie mentioned, all of this contributes to that family system suffering. And even though it's ideal to protect that child, and that's the ultimate responsibility that DCF has, we still want to find a way through that FAST program and other programs to find a way to help that system heal and teach them that this is the way to go as opposed to the abuse and the neglect options. I said it earlier and I kind of want to revisit that statement. Someone does not wake up and say, I want to abuse my child. It is distinctively a caveat of a deeper issue. And we want to get to the core and we want to get to the root. And one way to do that is not to compound that trauma by breaking up that system. And if we can find a way to do that, we can hold that family system in high regard.
In terms of substance abuse, how often are the cases that you see have that as an element in them? About what percentage would you say?
So I don't have an exact number for you, but I would say a high percentage of our cases involve substance misuse. That's really a symptom of an underlying issue. And I'm sure Nicole can speak more to it from the mental health side. But typically, what we're finding is that there's a deep rooted trauma that has occurred to that parent, and they're masking it or treating it with substance misuse. And so you can provide services to address the substance misuse, but you really need to address the mental health piece of it as well
Mhm.
to get to that deep core issue. I can give an example. We had a mom who had a case with us, and um, it turned out her substance misuse was just a symptom of her victimization as a
Mhm.
child herself. So she
Mhm.
had been sexually abused in her childhood, which turned into human trafficking, which
Mhm.
turned into her trying to just block that trauma from happening. And so, really engaging our families, getting to know our families from a non judgmental standpoint
Absolutely.
allows them a safe space to say, hey, this happened to me.
Mhm.
And when you can figure out the root cause, then you can really make an impact and
Mhm.
a difference.
Yeah.
We're talking about child abuse rates in Duval County, and you can join our conversation if you'd like. You can give us a call at 904-549-2937 or email us at firstcoastconnect@wjct.org. You can also reach out on Facebook or Instagram or X at FCC On Air. We've got a message from James on Facebook. He says, what can friends, neighbors, clergy members, or other trusted people do to help diffuse the factors leading to the abuse before the law truly needs to get involved? And I guess also I'd add on to that, at what point does the law need to get involved? At what point does somebody need to feel compelled to reach out for outside assistance?
I like to fall on the premise of see something, say something. It's better to have more to work with which to work than to have nothing. If a neighbor to the what the caller sent on Facebook, if a neighbor, a clergy member, a family member, identifies, some of those warning signs, some of the psychological distress that seems very incongruent to a normal behavior happening in that family system, have a conversation. Adversity is never easy. That's why we call it adversity. It's difficult. And yet there is something to be learned in mapping it out and exploring what's going on and why is it happening.
What kind of signs are people should they be looking for?
To the warning signs earlier for children, it's the bedwetting, the thumb sucking. They start to show fearfulness of something that they may have outgrown before. Like all of a sudden, they're fearful to sleep in their bed. And what we see a lot of parents doing, and I've seen this time and time again with young children in couple counseling, there's the issue with the child co-sleeping with the parent. And it distinctively is at a formidable age where the child should be sleeping independently and learning how to be autonomous, not only physiologically, but mentally as well. And so the coping skills, even in a healthy setting that does not have abuse, is an underlying issue that creates a core issue when they grow into their adulthood. It sets the tone for inappropriateness that happens, and that creates an unsafe mental health functioning for that individual who grows into an adult and then does not know the healthy boundaries.
Are there signs that might be more visible to people who are not necessarily part of the household or privy to what's going on in the household, who might not see things like bedwetting or regressive behaviors? I'm just thinking, of things
Mhm.
that are more like visible signs of physical abuse.
Right. So when we're talking about bedwetting and things of that nature, right before the segment started, we were talking about us all having children, right? Mine are distinctively legally adults, right? But all of us at some point in time are an aunt or a cousin or a sibling or a godparent. We have some level of connection. And we see when we may not see, to be very candid, the bedwetting per se, but we see the mannerisms are different. When a child has downcasted eyes, when they start to have frequent physiological symptoms, stomach aches, headaches, things that again do not promote them wanting to go to school. We start to see difficulty with concentration, just things that would not normally be part of their symptomatology.
Mhm.
It could be hormonal, it could be medical. But to your earlier question, this is when you bring in that resource. This is when you bring in those conversations and
It,
do the exploration.
it's just interesting to me that I mean I think most people think, well, I should be looking for black eyes and bruises and things like that, and you're really not necessarily advocating that as the best sign for a problem.
It doesn't have to be.
Mhm.
It's the difficult statement that I'm getting ready to make, but a lot of abusers are very savvy and very creative with the way they issue their abuse. I don't want to take away from the fact that earlier we were saying that it's unintentional oftentimes when a parent abuses or neglects their child. It's not an excuse, but it is an explanation. And so getting those workshops in there, finding another way to reduce the risk factors, allowing what can lead to parents being more confident, learning how to feel more capable, that's where we get to have a conversation. If I may take just the liberty of saying, I've sat in front of so many parents time and time again in a counseling session who weep at what they've done towards their children, who weep with being emotionally separated and with the visitation that they're allowed to have at the LJD JFCS. They still have that, I want my child home, even though they don't know what the next step is to take. And so it gets to be a conversation. How do you feel today? How are you treating yourself? How often do you shower? The conversations get very real. But this is where, like what Stephanie said earlier, these are places that are non judgmental. It is their safe space. And oftentimes, when someone has endured abuse as a child themselves, it becomes a generational pattern. And so they need to learn and get to learn how to create a safe environment here first in order to move forward.
Lynn, I've got a question here I want to sort of direct to you because I know that this is something that you've handled in your own work. This is Mark. He says, my daughter and her fiance had a baby at Baptist South. The caseworker misunderstood my daughter during the intake and labeled her a drug addict by accident and called the DCF hotline. For 50 days, my daughter has suffered from this error and she is completely innocent. A CPI was assigned and we told him there's no evidence. It was just a mistake. How do I get in touch with the lawyer at DCF? The hospital agrees it was a mistake, but they have no way of reversing it.
That's going to be tough because that is going to remain a part of DCF's records for years. And I've actually, those were the cases that I was contacted by some agencies in Texas similar to that. I don't know if a DCF attorney is going to speak with an individual outside of a CPI. That's going to be very difficult to do. Now, unless the baby's been removed, Children's Legal Services isn't going to be involved at all if there's been no court action. If there's court action, then the parents are most likely going to be court-appointed attorneys. So what do you do if it's not a court case?
Not yet.
And that's a huge problem because most people cannot afford to hire an attorney to help them work through this system. And I have a case now where a report was called in by most likely a nurse at a hospital. This is out in the Panhandle. And the accusation was Munchausen syndrome by proxy, and that the mother was neglecting or abusing her 16-year-old daughter. And I heard some similar things. The mother had said some things to the nurse, and the nurse had misunderstood her, and these things made their way into the hospital file. You can't get that changed. What a nurse has put down in that file. And it's just incredibly difficult. Don't give up. Talk to the CPI. Being a team
And that's
player.
the child protective
I'm sorry,
investigator. Yeah.
yes, the child protective investigator. Be a team player as much as possible with them because we like to think, and I like to think, that the CPI truly does care about the safety of the child and the safety of the child and the child's family. It's hard. There's no real solution other than don't give up. And I hope that that baby wasn't removed. And shouldn't have been removed if the mom and baby did not test positive for any illicit drugs or alcohol at birth, and the hospital would have tested for that.
We're going to have to leave it there. There's so much to talk about. Obviously, much to be done on this front. But I thank you so much for being here. Stephanie Metzger, Lynn Salvatore, Nicole Davidson Harshaw. Thank you so much for being here. Appreciate it.
You're welcome.
And thanks for the work that you do.
Thank
Thank
you
you.
for the work you do as well.